Every day, 10,000 people enroll in Medicare. As a country, we're getting older and more likely to face health crisis. Our medical expert, Dr. Sudip Bose, sat down with Tatum Gwynn with the one thing you need to know now to make sure that you're prepared if something happens to you.
Today's topic is not necessarily something that we think about every day.
We don't, and we should. Think about one of the most common things you do every single day. And many of you do this. It's getting on the road. And imagine you get on the road and you get in a car accident, you get a head injury, you're in a coma, you're unconscious, and does your family know what medical decisions to make for you? Does your doctor know? And the time to think about those things is right now. And what we're going to be talking about is advanced healthcare directives, what doctors call advanced healthcare directives. And what that is basically instructions for what you want your family and your loved ones and your doctor to do if you are in that condition and you need difficult decisions made. So we're going to play a little game here. I'm going to give you this clipboard, and we are going to pretend that we're at a sushi bar. And we're going to order sushi. Maybe one California roll, a couple pieces of sashimi, and basically, what we're going to do is we're going to think of different scenarios here.
Things that you want.
Things you want, things you don't want on that sushi menu. Now, the key to good instructions for your health is you have to think about if you are in a condition where you're permanently unconscious or you can't make your decisions debilitated, what you want done. So that's one of the keys. The other key is what you don't want done. There's certain things you may not want done. And finally, what certain treatment you want no matter what. So let's go back to your sushi order there.
Yeah, it's like a DNR.
Exactly. So your sushi order here, now we're talking not about sushi, but we're talking about car accidents.
Yes.
So do you want someone to start a big catheter in a vein here? Do you want chest compressions if you need it? Do you want antibiotics? Do you want a tube in to help you breathe? And you just have to think yes, no, and talk to your family and your physician about these. So these are your two important parties you have to talk to. So when you mention DNR, that stands for do not resuscitate.
Right, and it's more, it has more of a meaning than just that.
It does, because it basically means if your heart stops, do you want CPR done? But there's often misconceptions around this. It does not mean do not treat. You still may want certain things like antibiotics, fluids, comfort measures. So you need to clear these things up with your doctor. And one thing I'd point out is doing more does not mean you love somebody more. Doing less does not mean you love somebody less.
Just respecting their wishes.
Respecting their wishes. So if 98-year-old grandmother comes in who's been in a nursing home and she's in her final moments, maybe she does not want aggressive chest compressions that crack her ribs at the final moment. And doing less does not mean you love them less. So share these decisions, and unfortunately you know those conditions where the people keep their parents alive, maybe on artificial machines to collect a Social Security check. It's scary to have people making decisions for you, so be clear.
Yes.
Be clear about what you want.